Welcome to Surat CLTV. Thank you for visiting our podcast. Good morning, good afternoon, and good evening. Many of you asked me, and people often ask me when I interact with senior leaders in terms of how do you help us or support us understand the gaps in the talent within the organization. So we call it the talent health diagnostics. So what we basically do is we've identified at least 10 areas that we'll take into account and look into each one of these and try and refer to the data that the organizations have or some background to that data. Also, we do focus group discussions and some of the interviews. We also do interviews with the senior leaders, and we actually deep dive into each of these areas. So let me name some of these areas. So the first one, to my mind, is a strategic talent planning. Does the organization have a predefined strategic talent plan in place, and if that plan is aligned with the organizational strategy? The second important area we get into and do a deep dive is performance management process system, and in practicality, whether the managers and the employees are aware of the organizational performance management strategic objectives, and and thereafter the feedback process, the review process, the goal setting process, and so I can go and keep talking hours and hours, but basically the idea is whether your performance management process, systems, tools are in place or not. The third important area is succession planning, and this is primarily at the senior most level, CXO and below. Maybe sometimes it goes down to the director level, and we see whether we have the proper succession planning in place or not. And number four is leadership and managerial effectiveness. And all organizations have leaders, and they have leaders at the senior level, they have the leaders at the CXO level, and they have the managers and mid-level leaders, managers, and senior leaders. Now, the big question we ask is, do managers and leaders have the required competencies, behaviors, and capabilities aligned to the organizational goals and strategies, and are they performing to the required level and so we need to determine what is expected of them and what they're doing and see if there is any potential gap. The other important area we do as part of the diagnostic is the engagement and exit analysis. And engagement, I basically mean employee engagement, whether the employees are actively engaged or actively disengaged or appropriately engaged, and so on and so forth. And the sixth is the build versus buy ratio. We do a lot of focus on build versus buy, and this basically means you give preference to the internal talent when it comes to getting larger responsibilities and the next level of roles. And we also focus on number 7, competency alignment. And what that basically means is you as an organization have your goals and strategic goals, and you need to understand what capabilities and competencies are required to those organizational goals. And we see if there is a gap in that, and as part of our consulting, we help. Number 8 is the high potential development. So we'll look at whether you have the process of identifying high potential or not, and if you do have, how are you planning to develop? And number 9 is business alignment. Do you have the business strategies aligned with the people strategy? That's an interesting area to dig a deep down. And number 10 is important, last but not least, and we look at your HR and talent systems and tools and processes and policies, and whether they are aligned or not with the organizational goals and strategies. So basically there are 10 prominent areas that we use for talent health diagnostics as part of our consulting model. Hopefully this was useful discussion. Thank you so much.